Hi, my name is Brandon Torzala, and today I'll be talking about opioid usage and Narcan administration within healthcare. An overview of the opioid usage and Narcan administration is due to the significant part in extremely strong synthetic opioids, the opioid pandemic is still causing an increase in overdose deaths, underscoring the critical need for efficient preventive measures. By identifying patients who are at risk, encouraging safe opioid use, and putting people in touch with the community resources and treatment, nurses really help play a vital role in solving this problem, given that the Narcan may quickly cure the opioid overdose and dramatically lower their fatality rates. Providing the Narcan kits and appropriate training is one of the most successful evidence-based therapies nurses can use. By enhancing their ability to recognize overdose signs and equipping patients and caregivers to reliably deliver Narcan in an emergency, provide education, which helps further support preventive efforts. In addition to providing critical care, nurses also support community-based prevention initiatives, lowering stigma and increasing access to Narcan. Stronger, long-term responses to the opioid problem are supported by integrating nursing practice with healthcare policy, which also provides prevention frameworks. Next, I'll be talking about the pros and cons of the ethical dilemma. So some pros are opioids help play a big role in pain control in a clinical setting. Second is Narcan reverses the opioid overdose. And third, Narcan reduces overdose mortality rates. Some cons, though, of Narcan are the risk of abuse and overdose because they are highly addictive, the challenges to accessing treatment, ethical conflicts, and withdrawal. So research shows that opioid misuse is a significant public health problem. Unfortunately, there is a rising overdose death rate despite availability of the treatment. Opioids can be clinically beneficial for pain relief in a clinical setting. They are commonly used for moderate to severe pain, and when used the right way, which can significantly increase the patient's comfort. However, there is a high risk for misuse, making it challenging on the healthcare system. Narcan is highly supported when it comes to harm reduction strategies. It allows for way more time with emergency care and increases their chance of survival. However, it can raise some ethical concerns when it comes to patients' autonomy. For example, in the sense of a DNR order or a do not resuscitate order, giving Narcan could go against what they wanted. Because when Narcan comes in the system, it's going to ruin their high because it is wiping away the effects of the opioid. But for someone like a nurse, the ethical concern would be choosing between respecting the patient's wishes and saving their life, in which those wishes may or may not have been clear. Overall, it is seen that both opioids and Narcan have pros and cons. It is important to recognize both sides and make ethically sound decisions based on the specific situation at hand. Next, our stance in the ethical dilemma is our group believes that a patient's advance directive refusing the use of Narcan should be respected, even in an opioid overdose situation. Although there are exceptions for emergency situations, as it is difficult to verify a patient's wishes. The rationale behind this group stance is respect for patients' autonomy is a core principle of nursing healthcare ethics, and especially for nursing. Autonomy helps recognize a patient's right to make their own decisions in regard to their own medical care. And with that comes the right to straight up refuse any treatment they do not wish to partake in. And that includes the use of Narcan in a life-saving situation. That being said, in the event of cognitive loss, where they're unable to make their own decisions, there are certain advanced directives that they can give ahead of time, such as a DNR, where healthcare workers are to follow to still preserve their autonomy despite cognitive loss. And when a patient is able to make a decision or labeled as a DMC, when that directive is created, whatever choice they decide to make next is valid and then thus binding toward their care, whether it is for or against their treatment. What the DMC relates to is the patient understood the risk, the benefits, and the consequences of the intervention at hand, especially when relating to Narcan, thus preserving their autonomy and making sure it is upheld. And since an advance directive carries the same weight as a legal document, it means that they must be honored, and Narcan should not be treated any differently, even if a directive explicitly refuses the use of it as a life-sustaining treatment. Healthcare professionals have a duty to report clear, documented, and by honoring valid advance directives, help support professional integrity, their ethical practice, and promotes patients' trust in the healthcare system. As if a healthcare worker does not um, follow or respect their advance directive, it goes against their trust in the healthcare system. And however, in an emergency situation, validating or verifying the existence of advance directive may not be plausible, it might not be there. And then in these cases of certain uncertainty, a nurse's role is to uphold ethical practice, is to administer Narcan to preserve life, as it is ethically justified. This exception does not harm the autonomy of the patient, but rather acknowledges the limitations of emergency care and the responsibility of nurses to preserve life within those limitations. And support for our group stance. Patients' autonomy is a fundamental ethical principle. The American Nurses Association, their code of ethics, supports their self-determination. The Nurse Practice Act upholds patients' rights. Advance directives carry legal authority, life-saving care if directive cannot be verified. And our group stance is grounded in the ethical principle of autonomy, which recognizes a competent patient's right to make decisions about their own body and medical care, even if those decisions may result in death. The American Nurses Association, or the ANA, their code of ethics states that a nurse must respect patients' self-determination and honor in forming decisions regarding treatment refusal. This includes advance directives created when the patient had decision-making capability, or DMC. The Nurse Practice Act, the NPA, in each state also establishes that nurses are legally and professionally accountable for advocating for their patients' rights and following lawful medical orders and documented wishes. A patient's right to participate in these decisions about their care and refuse medical treatment is a well-established ethical and legal principle. Narcan administration is a medical intervention, and when a competent individual has clearly declined the use of it in a valid advance directive, that refusal thus carries a significant legal and ethical authority. However, during emergency situations where documentation cannot be immediately verified, the standard of care supports initiating their life-saving treatment under the principle of implied consent. Once the advance directive is confirmed, care should be redirected and reflected to honor the patient's initial wishes. Thank you.